something different, which is a doctor of osteopathic medicine. And what is that? Does that matter for your health? And as a doctor, I feel I should clear the air on DOs and MDs so that patients have the real facts and there's no misinformation. So first and foremost, I'm genuinely surprised the New York Times is even talking about DOs. Like, it's not a new thing. DOs have been around pretty much forever. So again, I'm not sure why they want to talk about it now. For anyone that does not know, if you want to become a board certified physician in the United States, you can get it with two different degrees: the MD degree, or the medical doctor / doctor of medicine degree, or the DO degree, the doctor of osteopathic medicine degree. Both degrees allow you to become a board certified physician in the United States, and both are essentially interchangeable. So when you see a doctor who is board certified in a certain specialty, their degree, whether it's MD or DO, really does not have any bearing or matter for you, the patient. They're both pretty much the same thing. Both are equally capable, equally trained, and really any difference in quality is dependent on the individual physician. Now, there are a few subtle differences historically between the two and also early on in the training. First and foremost, the DO programs are less competitive than MD programs to get into. So a pre-med going into a DO program generally has lower MCATs and GPAs than a pre-med who's getting into an MD program. So the MD programs are a little bit more competitive and desirable. Along with that, really competitive medical specialties tend to prefer taking on MDs over DOs, so there's a bit of a stigma there. But again, at the end of the day, once you finish your training and gotten into med school and residency and gotten board certified, it really does not matter. The other aspect is the basis of the training used to be different. Historically, DOs were known to be more holistic, focused on primary care. MDs a little bit more specialized and just organ-based. But over the decades, MDs have learned to take things from DO programs, like becoming more holistic, and DO programs have learned from the MD programs and taken in more scientific and fact-based stuff, and essentially they've melded into the same thing. So going to DO medical school, you will learn pretty much all the same things as the MD medical school. Only difference is the DO programs, I believe, still teach OMM, which is a type of musculoskeletal manipulation technique. It's not based in science, but some people do stand by it, and that's something DO students get to learn. But beyond that, the med school training is the same, and there are DO residencies different from MD residencies, but again, they're pretty much equal, and a lot of times DO students match into MD residency programs. So again, the residency is not different between the two either. So essentially, when they finish their training, they've both passed pretty much the same exams, both done 4 years of med school, several years of residency, both become board certified, and both equally capable in their training and background. It really just depends on the individual doctor. So hopefully that clears the air.